I'm Dr. Rohan Jahagirdar, consultant psychiatrist. My take on the current situation and this case, although hypothetical since I don't know the entire details, only by processing the data, a few clear psychological points that are understandable are that this was an instrumental act of aggression, by which I mean it was a premeditated murder. It was not an act of impulse, not an act done out of rage, not an act done out of lack of emotional control. It was done with proper emotional and cognitive planning. It was done as a pre-planned or instrumental act of aggression. And why it could have been done that way? Because the cognitive distortions or dissociations which were made essentially told their mind that avoiding prioritizing public shame, in this case cancelling of the engagement, would have been a much difficult proposition than the taking of the life, which kind of at their cognition justified it because they prioritize public image more than taking of the life. This would have happened because of the cognitive distortions once the person starts thinking. Such type of triads, cognitive triads which combine narcissism, which is a personality issue, manipulation and a lack of empathy together are seen as traits in people who are commonly associated with such kind. The other element here which is more important to notice is the behavior post the act, which also demonstrates significant amount of manipulation, like posting of grief messages to gain sympathy, to change public perception, to act act completely normal and as in form of grief, which also demonstrates very high degree of control and manipulation. The element of the partner or the boyfriend here also demonstrates a form of shared delusion or a shared idea of the same. The number of calls that the data suggests or shows says that the amount of time they have spoken about it must have created kind of an echo chamber where talking about it repeatedly kind of decreases the guilt or the shame associated with the act, over a period of time justifies to themselves what they are doing, and kind of cognitively indicates that the final goal justifies whatever they have done. I will repeat myself, these are only psychological assessments based on the data that we have in terms of news and other media. This should not be considered as the complete assessment of the person, since I don't know them. Thank you.